Good afternoon, ladies and gentlemen. This is Woody Collins with Congo Helping Hands, and we are here to talk about Congo. This is our 106th episode of talking about Congo. The subject today we're going to talk about, number one, is um, a subject that's kind of familiar to all of us, that I've been talking about COVID in Africa and COVID virus that's going on specifically in the Congo. So we're going to talk about that a little bit. And the second item we're going to talk about is part of some of the things that I've learned so far out of the UNC, that's the University of North Carolina. They have what they call um, a Water and Health Institute uh, program every year in the fall. And I've been to that on a number of occasions and even presented some of the work in a poster of what we do in the Congo. So this year it's all virtual and it's free. So didn't have to drive to North Carolina, didn't have to pay any money, hotel fees, but I'm enjoying the preliminary session that was held this morning. So I'm all excited about that. So let's go ahead and get started with that first subject of the COVID virus in Africa, and specifically, why is it so low? Some of the countries are low, especially like the Congo. They have over 10,000, almost 1,100, 11,000 cases. However, uh, they only have 305 deaths. So what is going on with that? And one of the things in the plenary session this morning, they started talking about some of the experts from Georgia Tech, the UNC, CDC, and all this. They had a round conference, and they finally got on the subject of Africa after beating around what we know here in the United States. And they came up with three different uh, say hypotheses that have been proven yet, but it seems worthwhile and something that we should explore. So let me tell you about there was five of them. The first two of them was something I have always talked about. Number one is testing. Testing in the Congo is very haphazardly and centrally located. Uh, and so there's not a lot of testing going on like we have here in the United States. And also they were talking about maybe some of the even reagents may be not good or something like that because they have not have come up with the cases that they've had. So, but compared to the United States, where we have a lot of deaths, they have not had a lot of deaths in the Congo. So the second item was the age. Most of the African countries have a younger age than the United States. Uh, they're, like in the Congo, the medium age is about almost 16. It's between 15 and 16. So therefore, they have a much younger population. So as we all know, the younger population gets over it, and it can be more uh, asymptomatic with the disease and not affect them as much. But for older people, it's very could be very risky and deadly. So they also mentioned that that is what they've seen, and I've seen a statistic from Congo that the death is a lot of the people over 60 years old. But one of the things that I had not thought about, which is, after they said it this morning, I go, oh, gee, I knew that. One was most of in Congo, you have a lot more outside settings. You are number one. You are go to meetings outside. You sit down outside bars. Sit down for outside eating. The windows are open because they don't have a lot of air conditioning. and it's always airy, breezy, uh, and so it's a lot more open and you spend a lot more time, especially in the Congo where the temperatures are uh, pretty moderate in the evenings, in certain parts of the day where it makes it really ideal to sit outside and sit under a tree or whatever the case may be. So that outside uh, is also being, uh, as we say here, we have outside restaurants and stuff like that. Where here in Indiana, a lot of them are going to be closing up because it's just 50 degrees at the height of the heating day here in Indiana. And I just finished walking and it was pretty cool out there. And I didn't see anybody sitting outside. Passed by a couple of restaurants. And I didn't see anybody sitting outside. So, uh, that's one of the things that's going for a lot of Africa. And I did see, uh, when you think about it, in the springtime and the early summer, you've seen a lot of deaths in South Africa, and that was their winter. And a lot of the southern hemisphere, like Brazil and all those places that which had was really rampant during uh, the winter months, and it's the same thing that they're predicting here is that when people get closed up and not outside as much, that we're going to see a lot more cases of it spreading, and also it may inhibit our flu because a lot of people will be wearing masks, and so the flu may not spread as much, but the coronavirus will probably pick up. So that was something they mentioned. When after they mentioned it, I thought of. I go, yeah, that we do the same thing here, and we have been talking about it. So also the warmer temperatures. One of the doctors presented that saying that the life expectancy of the COVID virus is very temperature related, but it's the opposite of it's the colder the temperature, the longer it survives. So they were talking about 4 degrees Celsius, which is relatively cool. Uh, it's probably about 40 degrees. That it can survive. That's the longest it could survive. It can survive for days on surfaces and different things, and where you pick it up by just touching things. That's why they tell you wash your hands, don't put your hand in your face, and all that kind of stuff. So it resides a lot more on objects in the colder temperatures. The third thing that they mentioned is that it is also the humidity has a way of keeping it. It survives longer in a dry climate. And so that's one of the things that they're looking at that's going to happen here in the United States. Our winters appear to be a lot cooler, a lot drier, especially because we use heat in our colder temperatures, and the heat dries out your rooms, or dries out your wherever you're at, and so therefore it's going to survive a lot longer. But the temperatures may, back it off a little bit, but still, its survival cases are a lot higher in dry temperatures. So you may want to get the humidifier for the winter, and so that you don't have it going through. But those three things uh, matches Congo, and when you look at it, we have a lot of outdoor activities. Uh, just about everything is conducted. The only time I'm inside is at night, or when I'm going out to uh, going in to eat or something like that. Sometimes I eat inside, or a lot of times if I'm at a restaurant, I would eat outside. And also they have warmer temperatures, year round pretty much. And also the humidity, even during the dry season, it is still purely humid. For instance, one of the things that I noticed in the Congo, we have more fogs there during the dry season because the earth is producing a lot of humidity, and then we have even so the fall produce put some more humidity back in the air even during the dry season. So those are the things that made me think, and I go, okay, maybe there is something uh, besides the lack of testing and the age group where especially the Congo and the African countries are surviving a lot better from the COVID pandemic. So, that's a mouthful, and it was just, striking when I was sitting there listening to it. I was just shaking my head, going, "Okay, okay, okay, I understand that." Uh, so, I'm not going to talk about the second thing is other things that I've learned from the UNC conference today, but those two things those three items really hit home, and I thought it was worth passing on. So maybe you want to make yourself a warm, moist temperature in your house so that you can survive it a little bit more. So thank you again for coming on, and thank y'all for being there. And if you have any questions, by the way, tell me where you're at for the people who are watching right now, where you're coming in from, and whether you're in uh, in the United States or in Europe or Africa, and we will like to know. Finally, be safe, take care of yourself and your family, and be blessed. And we will see you tomorrow at 3 o'clock for another episode of talking about the Congo. And, you know, since this is a week long conference,